हमारा मकसद है कि हमारा बिहार स्वस्थ कैसे बने, और जो हमारा लोगो है एक ही लक्ष्य, प्रगतिशील बिहार, जिसमें बहुत सारे सेशंस होने वाले हैं स्वास्थ्य को प्राथमिकता देते हुए हमने हेल्थ पर बात करने के लिए आपको यहाँ पे इनवाइट किया है। सबसे पहला सवाल सर मैं डॉक्टर सत्यजीत आपसे करना चाहूँगी। सर, जब हम हेल्थ सेक्टर की बात करते हैं तो स्वास्थ्य के दृष्टिकोण से जो योगदान होना चाहिए जीडीपी का, एक्सपर्ट्स के मुताबिक 7 to 8% होना चाहिए, लेकिन जो वास्तविकता है वो महज 1.2% है। तो बतौर एक्सपर्ट आप इस पर क्या कहना चाहेंगे?
सबसे पहले तो हम हेल्थ को डिफाइन करें। हेल्थ अकॉर्डिंग टू WHO is not mere absence of disease, but it is mental, physical and emotional well-being. And added to that is the good environment. So health starts from there. Then the health care is not just treatment and prescription and operation. It's people's well-being, health related, from the mother getting pregnant, baby born, to the elderly people who are sick. So whole range is a health, health care. For such a, first thing I must say that I congratulate Government of India and the Prime Minister for giving world's most comprehensive health cover to the people. But I think it looks very nice and it will really serve. And me working in England for 17 years, where I done prior practice also for 4 years, no one gives money from the pocket. So it's a commitment to the government is that in next few years, 75 to 80% Indians will be covered by the insurance, whether it's a private insurance or government insurance. Again, with insurance, there's a lot of models there, and one model is in Europe that patients, people from certain income group, whole insurance is covered by the government money. Those who are above the level rich, they pay from the pocket. Middle grade get insurance, but the government gives a lot of incentive in income tax and all sorts of rebate to encourage to get the health care. So all of us are running a hospital, and fortunately, unfortunately, patients do come, even a disparate emergency or any disease, and there is nothing to disbelieve that they don't have money. So it's a big dilemma for us. It's a moral dilemma, what to do with such patients. And once President Abdul Kalam had come, and it was in the meeting, Bihar Chamber of Commerce, and I raised my finger and I told him, sir, is it possible that in this country, like there is a law that no vehicle will ply on the road unless it's insured. I think the same should be, no Indian should be without insurance. So that we who are running a hospital, we don't have to bother when we're treating the patient, and we will not refuse any patient a treatment. For this sort of service, and I must say the health also depends on the elderly. I have seen the care of elderly, where social worker picks up the old people from their home, take them for shopping and bring them back home. Take it in the whole area like that. I remember one incident where I was working in a small Scottish island, and there was a beautiful place between the hills and the sea, and there were hardly any road, so GP has to walk there to see the old patients. That old person fell off the bed, rang the doctor that I can't get out, can't get up, I've got injured my back. The GP rang health unit in the center, ministry, and a special helicopter, Air Force helicopter landed in front of his house and brought the patient to the hospital. Patient just had a muscle injury. So that's the commitment. For that, you need budget. The budget at the moment, 1.3% of the GDP, is absolutely meager, and such a good Prime Minister Ayushman will not be successful unless enforced by the budget. Because everyone has know that the tariff is so meager, and not revised since 2014. It means ECHS, not Ayushman, ECHS. And there's so much of delay in payment, that's causing a lot of problems to hospital managers, hospitals. So I think my public should demand that party which will give the maximum number of GDP percentage to the health and look after our health, we will give the vote. That's the way the things will improve. Thank you.